Hello, everyone. I'm going to wait a little bit until more of our participants jump on. So get yourself comfortable, get something to drink, and stay tuned for what I hope will be a really helpful and informative event. You know, my overall goal is to get this information into the hands of as many people as possible so that they can go through surgery far more safely with a lower risk of complications, heal faster, and actually change the trajectory of your health for life. So we'll give it another minute or so. I'm just going to keep track. We've got a bunch of participants on. I'm super excited about that. Thank you all for being here with me. This is the first time I'm doing a webinar type of thing, so it's a little awkward. I'm not the most technologically adept person, but I will do my best to give you a good presentation. I'll probably spend maybe about 30 minutes on my presentation, and then I really want to open it up for questions and give you the opportunity to, let me know what your concerns are, what you're worried about, and answer those questions to the best of my ability. Let's see. We're doing, got a few more participants to jump on here. I do value everybody's time, and I want to make sure that we're not, we don't go over time. So I will start here in about a minute. I'm gonna set up, to share my screen. There we go. I'm hoping everyone will be able to see that. There's also on the Zoom link a Q&A area. So please, as we go along, if you have questions that are coming up, go ahead and put them in that Q&A box. I will look at them at the end of the presentation, and we'll go through them and make sure everybody's questions get answered. Also, if you have questions afterwards, just message us, and we'll be happy to help you with those. So I want to welcome you to my presentation on secrets to surgery success, which, those of you who know us at LifeScape, our #1 mission is inspiring and empowering health transformation. We know that throwing pills at a situation is not a goal, is not going to get you towards health. So we want to improve everyone's baseline health. So this presentation is about how do we empower patients to optimize their own health before surgery, and why is that important? We need to talk a little bit about our sorry state of the union, and anyone who's heard some of our Facebook Lives during COVID, this has been a big issue, and why we ended up with over 20% of the globe's COVID mortality with less than 5% of the globe's population. And a lot has to do with our baseline health, and that's what we really try to focus on. We rank as a nation 35th in the healthiest country index. Our life expectancy declined for 3 straight years after 2014 and then plummeted in 2020. So really, since 2014, we have not had a significant gain in life expectancy. And given our that we're one of the wealthiest nations on earth, that's a disconnect. Over 70% of Americans are overweight or obese, and that includes at least 1/3 of our children. Over 100 million, or 1/3 of the population, are diabetic or pre-diabetic. 22 million have sleep apnea, and the vast majority of those patients are undiagnosed. Over 40 million Americans suffer from a mental health disorder. And that's also catastrophic among our children. The millennial generation in particular is really suffering the brunt of this. 45% of Americans have at least one chronic disease. Over 50% of American adults and children take chronic medication. And that should not be necessary. I dropped my computer, so things are a little sensitive here. Over 15 million adults misuse alcohol, 37 million binge drink, so about 1/10 of the population, or a little more than that. 34 million Americans smoke or vape, and 20 to 30% who use prescription narcotics will misuse them. So we have to be really cautious. A lot of narcotics abuse and a lot of those premature deaths from overdose are started in post-operative situations where people got started on narcotic fiend medications and then could not get off of them. So my term for the American population is we are overdoctored and underwell. We're spending more than any other nation on healthcare, yet have the worst return on investment. Oops, sorry. So I'm going to tell you a little bit about my story and what inspired me to develop this online program and write this book. It started when I was a physician at Mayo, and I needed a minor surgery for skin cancer on my eyelid and a ganglion cyst on my wrist. And a plastic surgeon that I was friends with was going to do the whole procedure for me in a combination. And I had no qualms at all. I was not at all worried about my health. I thought I was, quote unquote, pretty healthy. And I trusted the surgical team to do whatever was necessary. I was pretty passive about the whole thing. But after surgery, I developed a whole slew of terrible symptoms. I was so profoundly lethargic. My brain was not working properly. I swear I lost IQ points that I didn't think I could get back. I was in pain. Everything in my body hurt. I developed all the symptoms of something called fibromyalgia. I had, trouble focusing. My hormones were chaotic. So, this is what drove me to really look at the root causes of health, because here I thought I was pretty healthy. But I got introduced to functional medicine, which is what we focus on at LifeScape, which, so this was 20 years ago that I was first introduced to this. Allopathic medicine, which we've all trained, and I was teaching, I was the residency director at the Mayo Clinic and teaching the residents there, and I really thought I knew everything. But I thought I was pretty knowledgeable. I had board scores in the 90th plus percentile, and I knew my stuff. But what I knew was what we're taught in allopathic medicine, which is the top of this tree. Make a diagnosis and then throw a drug at it, or more, or multiple drugs at it. And that's just really kind of the way that we've been conditioned to think in medicine. Whereas in functional medicine, we're trained to think about the roots. What are the root causes? And that can be our genetics. And I was found to have some significant genetic issues that caused me to be unable to clear a number of the anesthetic agents and also hormones, which makes me wonder if my sister, who died of breast cancer at 42, might have had the same genetics. A couple of my daughters have some of those genetic issues, and that could put them at high risk from surgical complications, but also from hormone-related cancers. I had terrible nutritional deficiencies because I've been on acid blockers for many years because I was consuming a diet full of foods that my body didn't tolerate well. So I'd been on acid blockers for many years, so I couldn't absorb the nutrients out of the food I was consuming, and I was consuming a lot of gluten, grains, and, you know, for me, a balanced diet was a Diet Coke and, you know, and a bag of Doritos or something, which was terrible. I had digestive issues. I had poor sleep and stress management ability. And of course, being a residency director at the Mayo Clinic, there was no shortage of stress. I had 80-hour work weeks and 3 young children at home. And it was a very, very stressful time. But the main thing was I didn't have good strategies for coping with that. What this doesn't mention is some of the other roots include environmental toxins, things that we're exposed to all the time that affect our hormones, affect our gut microbiome, and really impair our ability to handle a surgical procedure. So this minor surgical procedure really put me into a tailspin. So this is kind of what's off kilter about our medical system. You know, we invest heavily in rescue or cure, treating a disease after it's already presented, whereas less than 3% of the healthcare dollar is focused on prevention. The Affordable Care Act aimed to shift that balance a little bit, covering evidence-proven preventive care and certainly a number of vaccines and things like that, screening tests, but we're still heavily a cure-based society. And that's largely why I think our care is so costly and such poor outcomes, because we'll spend whatever it takes to unblock an artery or to house an Alzheimer's victim or to treat a diabetic with insulin and a number of other drugs. But pennies on the dollar, we should be able to prevent or really stave off a number of those things. And the same goes with surgery. So here's the falsehoods that perpetuate what we're doing currently. For medical providers, we're conditioned to think that these preoperative clearance and surgical checklists are all we need to do. And many providers, I'm not one of them, believe that patients won't change their lifestyles, not willing. Many physicians also believe that telling people to eat right and exercise is effective and really all you need to tell people. And that's, you know, we understand that's not a strategy, that's a wish. And many of us also feel that they don't have time or energy to guide people to healthier habits, which it's much more difficult work to do that. Now, patients often think the way I did, which is I'm healthy enough, I'm pretty healthy. I don't have time to make healthier choices. I can't afford to take better care of myself. Or, you know, just cut it out, doc, or give me a pill, and that should take care of it. So these are some of the falsehoods that we want to actually get past. So this is the quick fix mentality. The line with all the people says toxic pills and surgery, and the empty one is lifestyle change. I'm going to just skip that one. So I'm going for a triple aim. You know, I want the patient to be healthier to start with before you get into the operating room, the patient to have improved outcomes, not just post-operatively, but lifelong. And I want there to be a cost savings in the system because we're all spending too much on healthcare and health insurance that we shouldn't have to. So I created this program partly because of my experience, but also my experience with a number of my family members, a number of my patients who suffered terrible surgical consequences that really could have been prevented. And some of those consequences ended up lethal. You know, so at least 40% of surgical mortality should be preventable. But the one thing we're ignoring in medicine is the health of that patient before they land in the operating room. And so many of our surgeries are predictable. We know when you're going to go in for surgery. They're not emergent. It's a small proportion of surgeries that are emergent. So I created this program based on a decade of research. It is very evidence-based. It is simple, online. The patient can do it self-directed. It is efficient, so max of 30 minutes a day over 2 to 4 weeks. I tell patients, at a minimum of 2 weeks before surgery is really necessary. In fact, my daughter, who's having surgery next week, is doing a crash course in this. Hopefully she listens to her mom. This is a comprehensive program, and I'll talk about the modules that I've developed. Has a number of downloads also. It's holistic. My aim is to prepare people mentally and physically. It is supportive. There's access to a closed Facebook community. And the normal program cost is $249, which is a fraction of the cost of a complication or a delayed recovery. But there is a special discount for those of you attending this webinar today, and that's 60% off or $99 using the promo code THRIVE. So if you go to optimizesurgery.com and use the promo code THRIVE before Monday, June 21st at 11:59 p.m., then you can get access to that $99 special promo code. I'll talk a little bit about the modules that I included in this program. The first part is just an introduction and baseline health survey. So I see where we are to start. Module 1 is optimizing healing via lifestyle and nutrition. Nutrition is foundational to health and to every chronic disease, and for our mental health and for our memory and prevention of disability and lifestyle. So we really have to focus on nutrition intensively right from the get-go. Module 2 focuses on optimizing detoxification, and that's getting your liver and your GI tract ready for surgery so that you can clear those toxins out and you don't end up like I did in a toxic waste heap of brain fog and pain and lethargy. Module 3 is mentally preparing for surgery. That's managing stress and sleep. Module 4 is minimizing surgical complications. And this program comes with an extensive download or handout that goes into all of the common complications with the goal of empowering you and whoever you choose to have as a supporter through this process to really understand what to look for, what to do to prevent a number of these complications, and when to ask for help when you really need help. And honestly, you really need an advocate in this process. If there's one thing that I've learned through many, many family members and patients is, when you're going into surgery and after you come out of surgery, you're not really capable of advocating for yourself. So I encourage people to either have a physician, like a concierge physician who can really be on top of the care team, a family member who's might be knowledgeable, a nurse advocate, or a friend, somebody who can ask questions that need to be asked, make sure there's clarity on what you need to be doing, and just advocate for you. I cannot emphasize that enough. I remember coming into the ICU to see a patient who had suffered terrible surgical complications that the hospitalist did not pick up. They did not clue into it and did not manage properly. And I just hear, as I'm talking to the ICU nurses and care team, I hear the patient in the background go, "The cavalry's here." And that's what we all need. We want to have that cavalry that's there when we need it. Module 5 is musculoskeletal fitness for surgery. That's just keeping your bones and joints and your whole body able to move and strengthened so that recovery goes so much quicker. And module 6 is all the strategies to optimize recovery after surgery. So what patients receive when they go through this program, there's over 30 lessons ranging from 3 to 20 minutes. This is the online program on optimizesurgery.com. There's over 20 videos with MP3 audio and written transcripts, so you can view it, listen to it, or print it out and read it. There are over 12 downloads of different handouts, recipes, and habit change tools. You get a daily meditation and meditations before surgery and after surgery to really help your mindset. And then there's some evidence-based supplement suggestions to support detoxification, optimizing your immune system, getting your gut moving, and healing properly. And these are just suggestions. They're by no means mandatory. If you're doing the other strategies that I talk about, they're really just an extra support. And always, 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 we recommend running anything like a supplement by your surgeon and the surgical team to make sure that they're okay with it. Many surgeons, I will say, are leery of any supplements because of the risk of bleeding complications with some. None of the supplements in this program will aggravate bleeding or have significant drug-to-drug interactions. They're very simple and just support your body's healings and detoxification systems. Patients do receive access to a closed Facebook support and community so that your questions can be answered and we can serve as advocates for you. There's a before and after overall wellness survey. So you can, sometimes as we make these little changes in our diets, in our sleep, in our stress management, etc., we don't necessarily know how much better we're doing unless you really see an objective survey. There's options, of course, for a virtual nutritionist or fitness coaching if those were necessary, or for those patients who really score poorly on the initial assessments, where they just have a huge, huge risk for surgery. We offer an option for a virtual functional medicine consult, which is like a 30,000-foot, very high level, very comprehensive evaluation and recommendations, because if patients score very poorly on that initial assessment, I would not embark on surgery until we get things cleaned up a little bit. So the goals for this program are to understand the risks and understand some prevention strategies, understand what to look for after surgery. My number one goal is an overall appreciation of health and a stewardship of our health, and understand we cannot be passive bystanders in our health. This was true for COVID. I would constantly talk to my COVID cases about, this is not a disease you can manage passively. You need to be an active warrior, not a passive victim. Another goal is awareness of lifestyle choices and how they impact our health. I'm hearing patients all the time tell me, I realized that cocktail I was having every night really messed up my sleep. And then I really felt poorly the next day, had a lot of digestive issues. And then I started to realize, why am I doing that? And that's the aha moment that really helps empower people. We also want to empower people to reduce reliance on medications. You know, no type 2 diabetic should ever need to go on insulin. That is a failure of our medical system. A lot of these things can be prevented, not entirely, but you know, the earlier we start and the more intensively you work on this and really pay attention to the payoff, you'll see a reduced incidence of chronic disease and a reduced need for medications. And one patient I just saw recently who in 1 year of these types of addressing her root causes, she was able to eradicate attention deficit disorder that she'd had for over 40 years, chronic anxiety and depression that she'd had for also decades, chronic fatigue, chronic insomnia, and get off of attention deficit stimulants, Paxil antidepressant, Xanax anti-anxiety, and Ambien chronic sleep medication. So 3 controlled substances and 5 medical problems eradicated within a year. That's the brilliant health breakthroughs that we're going for. We want people to be empowered to improve the health of our gut microbiome. This is the heart of our immune system, the heart of our hormone processing and even hormone production. It's the heart of our neurochemistry, our neurotransmitters, our brain communication chemicals, and the heart of our ability to clear toxins that we're exposed to every day. And then I also want people empowered with strategies to just improve your overall energy and vitality. So I'll talk briefly on the modules. The first one is optimizing healing, lifestyle, and nutritional strategy. So we talk about the 5 pillars of a healthy life, which if we each actually embodied these pillars, we could eradicate a huge percentage of chronic disease in this country and probably turn around our life expectancy. And those are pretty basic. Those pillars are maintain a healthy weight, exercise at least 150 minutes a week, eat a whole food, plant-based diet, and avoid refined and processed foods, sleep 7 to 8 hours a night, and learn how to manage stress in healthy ways. And then I also add the pillar of keep alcohol at a minimum, a modest level. We talk about health transformation strategy. So what things you as an individual patient really are going to be the value added issues to focus on to transform your health. And then we talk about how to commit to some habit change, create an environment for success, collaborate with others who can help support your success, and start to clean up our diet. The second module is really important, and that's optimizing detoxification. We talk about ways to minimize toxin exposures. We can't eradicate them. They are so ubiquitous. I mean, 70% of the foods in your grocery store come from corn products, are full of things like glyphosate, Roundup weed killer. You know, the #1 food source of glyphosate is Cheerios and oat cereals. #1 food source of phthalates, another hormonally disrupting toxin, is Kraft mac and cheese. I told my kids, you're just EPA Superfund sites. And then we talk a little bit about the supplement support protocol, especially for those people who have a lot of symptoms of potential toxin exposure. Module 3 is super important, and that is mentally preparing for surgery. The first section, we talk about mindset and setting a positive intention. And I'll tell you, I have a patient who had to have a minor surgical procedure, but was full of anxiety and very, very negative mindset around the surgery, and just intensely focused on everything that could go wrong. And so I really encouraged her to defer her surgery, work with our psychologist at LifeScape for a period of time, and it was maybe 3 or 4 sessions, just on shifting her mindset for a more positive intention. And she ended up going through that surgery, piece of cake, everything went perfectly. We talk about healthy coping strategies for the stress and anxiety that are normal around surgery, and then optimizing healthy sleep, which all of us always need shoring up on. Module 4, we talk about the surgical complications. And as I talked about before, assigning a medical advocate, having somebody who can speak for you and really watch and communicate with the team and understand what your needs are and when you need help. And it's also really important that that advocate be diplomatic. You know, the surgical team and the medical teams in the hospital are all doing their best, and they're all trying to serve people, and it's often a very challenging situations and exhausting. And having somebody who is a real squeaky wheel isn't always the best and safest thing. You want to work collaboratively with the team as much as possible, and occasionally you have to get maybe a little squeakier. We talk about the prevention and recognition of common complications, and most importantly, when to seek help. And there's a really extensive handout as part of this program that goes into that. Module 5, we talk about the musculoskeletal fitness for surgery and how critical it is, no matter what surgery you're having, to just move. Even my patients who are in a hospice situation at the end of life, the most important thing that makes them feel better is to move. The body needs to move. We talk about balance, strength, core, cardio, keeping your heart active and working, and flexibility. And then the most important is staying active around the injury. So a knee injury is not an invitation to surf the couch for weeks at a time. You know, I often say, if, you know, Christopher Reeve managed to exercise with quadriplegia, I think we can figure out how to exercise around that knee or that hip and keep the body healthy as much as possible so that you recover much more quickly and back to your normal activities. Module 6 is optimizing recovery. So, you know, a lot of focus goes into kind of heading into surgery, but it's just as important to focus on nutrition, hydration, clearing toxins after the surgery. We have a recovery checklist that's included in the program, and pain management strategies that are proven to reduce the need for narcotic pain medication, because none of us wants to end up, either ourselves or a loved one, dependent on narcotics and in a dangerous situation. So I have a couple testimonials here I'll put up, but then what I'm going to do is talk a little bit about the program. So there are 2 different options for people to engage in this program. There's the online program, which I said is available at optimizesurgery.com. And again, if they use that Thrive promo code before Monday night, June 21st, they can get a 60% discount, so a $99 charge. Physicians who are interested in this program can go to optimizesurgery.com/partners to learn about offering this program to their patients. And then There's also my book that made the international bestseller list on Amazon in 4 different countries, Secrets to Surgery Success, Take Charge, Heal Faster. So this is really the abbreviated version of what's on the online program, but very quick to go through. This is what I'm making my daughter read before she has her surgery next week. So hopefully she'll listen to her mama. And we're going to be giving away several of these to some of you. So get my screen back here. Hopefully. Share. There we go. Oh, I can get it. I'm so excited. So let me know. I want to see if there's any questions that have come up. I'm not seeing any yet. I would appreciate if you let me know if you have any questions. The book is available on Amazon. It's also available at LifeScape. And if there's any questions about the online program, I'd be happy to answer those as well. So let's see, test question, but I'm not seeing any questions yet. Sharon, do you have a question? I don't know how to. Sharon, did you have a question?
I get it. I'm on mute. Okay. Hi. Thank you so much for this. This is fabulous.
Oh, thank you.
The question I have is the online program. Is there like does that expire at a certain, like, how long would I have access to it?
The online program, you have access to it as long as you, there's no expiration to it that I'm aware of. So okay. Yeah, if you purchase it, you're got it. And you can go back to it again and again.
That's great. Thank you.
You're so welcome. Thanks for joining. Let's see, questions. How long after surgery is infection possible? That's a good question, Diane. And it's difficult to answer. Certainly the most common infections like pneumonias, urinary infections, or wound site infections generally occur within the first few days even, or a week. However, I have seen wound infections and other complications of surgery that are infectious that go on for months. I mean, you know, if a person gets a bad wound infection, that can be months and months of healing. So yeah, it's not always that clear. Let's see. Somebody else have a question? I saw something about PBM lasers. I'll just mention that briefly. I talk a little bit about some of the extra devices and things that might be available after surgery. I really didn't go into laser therapy or cold lasers or microcurrent therapy or that type of thing. I touch on it in the post-operative pain management things, and there are a number of different therapies. We also talk a little bit about lymphedema therapy or lymphatic massage. I talk a little bit about using venous sequential compression devices after surgery for preventing blood clots. But I didn't get into specific, you know, talking about specific equipment because I figured that's a fairly constantly changing field, but it is something that we're always looking at. Our goal, again, is empowering people to be able to self-manage as much as possible without the need for a lot of narcotic pain medication. One of my patients who did a testimonial for me, had the same surgery twice. And the first time had not done this program. I hadn't developed this program yet. The second time she did this ahead of time. And even with going in for the same surgery a second time, where you've got more scar tissue, more complication risk, more challenges, her recovery was lightning fast. Her use of narcotic pain medications was less than half the first time that she went through it. So that to me was an exciting outcome, and told me, okay, I think we're on the right track. Diana, I've got, will this program help with preparing for procedures and tests using nuclear medicine and contrast? You know, that's a really good question. Particularly the first two chapters on lifestyle, just basic lifestyle and detoxification in particular, could be really helpful, especially for people who have a hard time clearing some of those contrast agents. That's very similar to how my body works. It's not very good at clearing some of those toxins. So you want to kind of shore up ahead of time and then do the post-operative strategies, which are all about detoxification as well. Susan, do we want to do this even if we aren't scheduled for surgery, as a proactive for surgery at an unknown future time? You know, this program is really a culmination of a lot of the things that we recommend over time anyway. So the health outcomes that I see from it include prevention of chronic diseases, reducing medication dependence, ideally over time, improving energy and health and vitality, just basic, you know, like I said, I didn't know, and I think most people in this country do not know what healthy feels like. They don't know what healthy is. I didn't know what it was as a residency director at the Mayo Clinic. So, you know, that says a lot. So, you know, going through this program really could teach you what healthy is, what, you know, help you figure out what's not working for you, and maybe where your best focus might be in terms of trying to tweak and develop new habits. You know, what I'm asking people to do in this program in, you know, 2 to 4 weeks took me a decade to do myself. And, you know, in terms of changing my diet, by little changes, you know, I got rid of the Diet Coke habit, which was way harder than it should have been. I think there's a little cocaine in that formula. Getting off a lot of the refined and processed foods, getting off of gluten grains, which for me caused 90% of my pain and 90% of my gut issues and a lot of my fatigue, and eliminated my need for acid blockers. Starting to exercise more, learning to meditate, and developing a meditation habit. You know, it took me a decade to do that. In this program, I'm kind of crash course for people, and a lot of you, as our patients, are already well on the path of doing a lot of these things. But yeah, my goal is that it could help anyone, and I just want to get it out there in the hands of more people before surgery, so that we can prevent some of these complications that are really prevalent. Let's see. Diane, if facing surgery of the joints, is a second opinion a good idea? You know, I am always, unless it's an emergent type of thing, it doesn't hurt to get a second opinion. And there may be 5 or 6 different opinions among different surgeons, how they're trained and that kind of thing. So, you know, I tend to also ask try to get referrals from the people who have to deal with the outcomes the most. So for orthopedic surgeons, in fact, that's what my daughter has to have next week. First people I'm going to ask about who's the best orthopedist for this issue are going to be the physical therapists who deal with the aftermath of that surgery. They help us develop much better referral network. I also have an insider who runs the robots for a number of the knee replacement surgeries and some of the robotic surgeries who can tell me inside the OR what some of these physicians are like. So we get some inside information that way. I always chose obstetricians for patients based on the labor and delivery nurses' recommendations because they know them inside and out. So I think it's never a bad idea if you've got time to get a few opinions, but sometimes it gets a little overwhelming, and then you need the physician to sit down with you and say, okay, let's think about this and prioritize, because you got to make a decision at some point. Ryan, you said that I found that functional medicine using science was the key for your dysautonomia, which is really a commonly missed problem. And it took many years to figure out, and a genetic issue. And it's a genetic issue that could affect surgical risk and a number of other things. So yeah, I can't say we're perfect at figuring these things out, but I think our main thing is we don't give up that easily. If we can't figure out, we'll refer to other people. We'll collaborate with other people. We collaborate with each other and say, well, what would you do for this particular issue? I think, really probably the most important value for a physician is beyond integrity is humility. And as I often coached my residents at Mayo, I'd say, if you ever feel like you know it all, then you better get out of this business, because then we're in trouble. So I think that's about it. I really appreciate all of your participation today. And on a Friday evening, I hope you all have a wonderful weekend. And again, if you're interested, or if you know somebody else who may be having surgery, hook them up with optimizedsurgery.com, or get them a copy of my book, and hopefully that'll really be helpful and improve. If I could improve one outcome or prevent one surgical mortality, that would be phenomenal. Thank you very much, and you all have a good weekend.